Hi, I'm Dr. Bone.
Hi, I'm Dr. Tartaglia.
Today we want to bring a topic up that we've had some questions about, and that's one of the services that's provided by a hospice organization, and that's called Respite.
Respite is a service that each hospice patient is allowed to receive or receives at the time of admission. And basically a respite level of care is normally given with the patient as having caregiver strain, if the caregiver is having some strain and maybe they just need a break. If there's a planned vacation, say they're going to have repairs done in their house and they want their loved one's demented and can be easily agitated, they might leave their home for several days. If they had to attend a wedding, a funeral, those kind of things.
So respite is actually more for the family than it really is for the patient. You've got a family that's been taking care of a patient and now an event has come up that they would like to attend. They need to make some repairs at home and it's going to be too disruptive, too dusty, too many fumes for the patient to be able to be safe and in that environment. So respite service is offered by the hospice for the patient, and the patient would go to a place and the hospice organization would pay for it and would keep them up to 5 days. And I think by CMS rules, they're allowed 5 days up to once a month for that respite care. So the family might leave town, they might go to a wedding, they might have a graduation ceremony, they're going to pull a rug, they want to paint a room, but the patient can't stay in the home or they can't be in the home alone. But they're stable. So they're not going to house sit for you, but you need that individual taken care of while you're going to be gone, and that's what respite is for.
Yeah, so they bring them to a facility that they're contracted with. It's usually a skilled nursing facility where they go. That facility will provide the food. It's a safe place location, so their aides and stuff there will take care of them. And also medications. Usually the patient brings their medications in with them, but it depends. Some medications the facility specifically wants to have ordered in-house versus out-of-house. And the hospice team does visit them while they're on a respite level of care.
Typically they're going to see a nurse every day, maybe every shift. They're going to certainly have the aides and the hospice staff checking in on them, because they don't just put them in a room and then leave them there. They're going to be checking on them the same way they do any of the other patients or residents of that facility. If it's a contract nursing home or if it's an inpatient care unit, they're going to be evaluating that patient. They may or may not see the physician. The hospice organization I worked for here in Florida saw them at admission. The physician would see them. If they came in on a weekend and a nurse practitioner was covering the service, then the nurse practitioner would see them and the physician would see them on Monday when they came back. But they would get at least one physician visit or one advanced practice visit from another practitioner while they were there. Now, if everything is stable and there's not much happening, then they're just going to get the routine care at that facility. And then when the 5 days is up, or 4 days or 3 days, but however long before the family returns home and they're ready to receive that person back in the home, at that point, then the patient just goes back home with their regular meds.
Yeah, and I've had some patients that the family was going to be away for an extended period of time, so they contracted with the facility and they would pay those days separate, so then it could be an overlap of the 5 days. I've had some patients that need to be there for, like, let's say a month. So maybe the hospice would pay for the first 5 days, family pay for 21 days, and then the last 5 days after it's been 30 days, then the hospice takes over. So really the social worker and the interdisciplinary team really works on that, but it's more the social worker coordinating with the nurse. The physician or the advanced nurse practitioner will also help with the medications, to make sure that there's an active med list that goes with the patient, and make sure that the patient has whatever creature comforts they want from home with them.
Yeah. So if they want to send some things in from the house along with the patient, then they certainly can. And definitely, like a change of clothes. Not too many people are thrilled with the gowns that are provided at, a hospital or a hospice unit, so they would prefer to have their own pajamas and prefer to have their own clothes to wear during the day, and the staff's going to help them with a bath. They're going to help them get dressed if they need help eating, because typically the patients who need respite care are the ones who are unable to be independent and they need assistance with their golden hour. And we talk about golden hour in a different in a different video, but basically it's that first hour of every morning, getting up, going to the bathroom, brushing your teeth, putting on your clothes, and they know that those patients who need respite need that extra help, and that's why they're there, so they're going to get that assistance.
To get the patient to the facility, it depends. Sometimes families will transport the patient if they've been doing that all along. But if a patient is completely bedbound and debilitated, then there is a non-emergency transport that hospice is contracted with. And again, that's not something a family pays for.
Yeah.
I mean, it's
by
covered by the hospice Medicare benefit. So it's really nice. Sometimes, I've had patients go to respite and we tell the family, it's for you to take a break, just relax. And then they'll show up at the facility and still visit.
Yeah.
And it kind of creates angst for patients that have altered mental status, mostly caused by dementia. So we really try to tell the family, this is your time, take your break.
Stay away. It's sort of like going to pick up your kid at daycare. If you show up in the middle of the day just to say hi because you were around that area running errands, I'll just go see my kid, your child is going to not be happy to stay there because they anticipate you're here, I'm going home with you. And that's kind of what it's like for a dementia patient being in a facility. You show up because you just thought, I want to go visit them and let them know I love them. They're going to want to go home with you, and it makes it more difficult.
So it's good to just keep things consistent for them, and I don't ever suggest family to visit while the patient's on respite.
When I worked for a hospice organization here in Florida, and mostly was at their inpatient care unit, I started there and finished there every day. We had respite patients that would, come in, spend their 3 to 5 days, and then go home. And I know we had a patient come in, and he'd been there for a couple of different times because his wife was also elderly, and they had a son that worked that helped take care of him and spent quite a bit of time. He didn't live in the home per se, but he spent enough time to live in the home because mom couldn't do it all herself. So the older patient, he was not really demented. He had some cognitive impairment, but it was mild. He knew who he was, he knew where he was, and he knew that he was terribly ill. And he came in and he got his respite care. The son had been out of town, and the wife is too debilitated herself to drive in, so she was not able to visit with him, but just on the telephone while he was there. And it's time for him to go home. Everything has gone pretty well. He's declined a little bit while he's there, and he's more weak, and we're going to transport him back home by non-emergent transport. And so for some reason, when the non-emergent transport came in to load him up, because he was not going to be able to be transported in a chair, he was going to have to be transported on a cart or a gurney. And they're getting ready to load him up. They're testing his orientation and asking him mentation questions. What day is it? What time is it? Have you eaten breakfast? And, he was answering those questions slowly, but you could tell he was frustrated. And then they asked him, and who's the president? And he just looked at those transport guys and kind of lost his temper a little bit. And he said, I'm old and I'm sick and I want to go home. I want to be home when I die with my wife. Can you just load me up and take me home? And I just had to laugh because, the transport people are just trying to do their assessment. And this guy knows exactly what his circumstance is. He doesn't know or care who the president is. He was able to give them answers about day and not date, but he knew time. He didn't care about those things, but he knew enough to know, I'm ready to go home. Take me home.
That's so funny. Yeah, so it's just a good service, and so it's a service that we wanted to talk to you about because a lot of people don't know about it. Some patients never use it, and it's a very good service to tap into.
I think it's probably one of the least utilized services, and I think it is an excellent service that many families don't realize is available to the patient and to them to give them a break.
Yeah, everybody needs a break. And this is a safe environment for your loved one to go into. They'll have the community of the team taking care of that patient. So even though they might be away from you all, they'll have that consistency too.
And maybe it's not just a vacation for you, but it's a vacation for the patient. And then after being in another environment for a period of time, maybe they just really do appreciate what you do for them, and they really appreciate being home. You really appreciate them being back home. So sometimes it's nice to have a little break.
Yeah. And I commend all those caregivers out there. Caregiving is a full-time job. It is a job. It's a service. It's hard work. And when you're taking care of your loved one and watching them decline, in a stepwise decline, it hurts on the heart.
Yeah.
So utilize your respite service for hospice and take that time and take that break, because like Dr. Bone said, it's good for both you and for the patient.
I hope that answered some questions, and thank you for listening in today.
Have a wonderful day. Thank you so much. Bye-bye.
Bye now.